What are the transfusion-transmissible infection? What is your idea? Kiki disease blood transfusion থেকে spread হতে পারে। Blood transfusion থেকে spread disease. What are the diseases that can be spread by blood transfusion? HIV. What else? Hepatitis. What else? All viral. Those are blood-borne virus. So transfusion-transmissible infection are those three criteria. Those diseases which are usually spread by blood. Second, that can survive in the blood bank. These are the two main criteria for transfusion. Aste তোমরা কথা বলে নাও, কথা বলা হয়ে গেলে তারপরে বলো, then I will start. This is not only important for your microbiology exam, but this is important lifelong, because you have to deal with blood transfusion in whole life. So you at least some idea about transfusion-transmissible infection and how you can prevent those transfusion-transmissible infection. There can be divided into exogenous and endogenous. What is exogenous and what is endogenous? TTI can be divided into two parts. One is exogenous, what is another part is endogenous. Endogenous part is those that organism is present in the donor blood. This is present in the donor blood, and this is exogenous, means it can be contaminated while collection of blood, while storage of blood, or during transfusion. So exogenous is not the organism present in the collection, storage, or transfusions. So these are the primary division of transfusion-transmissible infection. Now let's start. Now let us know about some history of blood transfusion. First, blood transfusion between animals were taken place in 1665 when William Harvey was experimenting about the blood circulation. Next, first animal to human transmission was carried out by Jean-Baptiste Denys in France. First successful blood transfusion was performed by British obstetrician James Blundell to treat postpartum hemorrhage in 1880. First successful whole blood transfusion was performed in a hemophilia patient in 1840 by Samuel Lade. Blood transfusions were avoided until late 19th century because of severe reaction and mortality. Why there was severe reaction? In initial this blood transfusion, why there were severe reactions? Do you have any idea? Initially when blood transfusion started, British obstetrician in 1880 for PPH, 1840 by Samuel Lade, but after that for few years or few decades there were no transfusion. Why? The reaction in those days, blood group was not discovered. Blood grouping system was not discovered. It was in 1901 where 3 blood groups were discovered by Australian Carl Landsteiner. First blood transfusion surgery was performed in 1906 at Case Western Reserve University. World First Blood Donor Service was established by Red Cross UK in 1921, British Red Cross Society, and first blood bank was established in Leningrad in 1932. So these are the few history of blood transfusion. ABB's Transfusion Transmitted Disease Committee in 2009 has identified 68 infectious diseases that can be transmitted by blood transfusion. But the list is now even larger with discovery of the new virus and emerging infections. So list is going longer and larger. Why there is transmission? We are doing testing for those disease, but still there is transmission of transmissible infection. Why? It is mainly due to the window period. Window period where no antigen or antibody can be detected. So antigen antibody were negative during this window period. So the main role of window period for transmission of infection. The blood products supply may be susceptible to contaminated by unidentified human pathogens. So these are the two risks. Blood product used in the transfusion may carry bacterial, viral, parasitic. So these are the three type of organisms that can be transmitted by blood transfusion. Maybe bacterial, risk of transmission of bacterial infection, that is TTBI. TTBI is, do you have any idea? TTBI is most common in which type of transfusion or which component? The transfusion-transmissible bacterial infection. Which component? It is the occurrence is commonest. Whether it is a whole blood, whether it is RBC, or whether it is a platelet. So the chance of bacterial infection and other infection is most common in platelet transfusion. So this is the list of the common pathogens that can be transmitted by blood transfusion. HIV 1 and 2, hepatitis A virus, hepatitis B virus, hepatitis C, hepatitis D. All hepatitis virus can be transmitted by blood transfusion. Human T-cell lymphotropic virus, dengue virus, chikungunya, Ebola, parvo, influenza, West Nile virus, Nipah virus, Epstein-Barr virus and human herpes virus 6 and 7. Parasite, Plasmodium, both Vivax and Falciparum, Babesia microti, Trypanosoma, Leishmania and Toxoplasma. Bacteria, Treponema pallidum, Staphylococcus epidermidis, Staphylococcus aureus, Bacillus cereus, Streptococcus viridans, Propionibacterium acne, Enterococcus and Yersinia enterocortica, Morganella, Acinetobacter. Ongoing enhancement in infectious disease assay. Meticulous donor screening methods contribute to enhanced safety, but still the rate has decreased in last few years, but it is still there. Now TTBI. Bacterial contamination can occur during collection of blood, during storage or processing, or during transfusion. Common source is bacterial skin flora. That's why the skin disinfection is very important while collection of blood, while transfusion of blood. Whether it is you are collecting for blood culture, whether you are putting for blood transfusion, skin disinfection is very much important to prevent infection of the patient by skin flora. The spectrum of pathogenic organisms varies based on the collected blood product. Now this slide is important, where you store, how you store the whole blood, store the RBC and store the platelet. Usually RBCs are stored between 34 to 43 degree Fahrenheit, that is 1 to 6 degree centigrade. favoring the growth of gram-negative rods. Most frequently reported bacterial organisms in RBCs are Yersinia. Why Yersinia can still persist at 1 to 6 degrees centigrade? If you read Yersinia, it can survive 4 degrees centigrade. That is, even cold incubation, Yersinia will grow. That's why even if it is stored at 1 to 6 degrees centigrade, the Yersinia enterocolitica persists. Other commonly organisms, Pseudomonas fluorescens, Enterobacter, Serratia and Escherichia coli. Some studies have shown Babesia microti. Babesia microti is not a bacteria, it is a parasite, but in few studies, Babesia microti has emerged as the most frequently associated organism. Not in India, the study was outside India. In some outside India study, Babesia was the commonest organism after RBC transfusion with fatality. Platelet. Why the infection rate is more or in platelet transfusion? Platelet transfusion creates more risk than any other component. First point is platelet products are stored between 20 to 24 degrees centigrade. So it can be stored at a higher temperature. That is the first point. What are the two other points for platelet? What are the types of platelet donation occurs or platelet transfusion? One is pooled platelet, pooled. That means it is from more than one donor. Pooled platelet sometimes used or apheresis platelet, apheretic platelet. So this is of single donor. So platelet transfusion may be of pooled donor or may be of multiple donor. The cost is higher when you are using platelet from a single donor. Apheresis of platelet is costlier. The most prevalent organism after platelet transfusion is Streptococcus viridans, Streptococcus bovis, beta hemolytic streptococci with an incidence rate of 39 to 48%, coagulase negative staph 21 to 24%. Staphylococcus aureus has an incidence of 4 to 9%. Syphilis, another bacterial organism caused by Treponema pallidum, primarily transmitted by sexually but can be transmitted vertically from mother to fetus. It is decreased due to stringent screening. What are the common tests we usually do for syphilis? Common antibody, non-specific antibody tests we do are VDRL or RPR. But these are antibodies, so it takes time to develop. That is non-specific antibody test. What are the other tests? That is, these uses which antigen? RPR and VDRL, which antigen is used? What is the antigen used in non-specific treponemal test? That is cardiolipin antigen. Cardiolipin antigen is used. But we can use particle agglutination or heme agglutination test, which is treponema specific antibody test. Either particle agglutination test for treponema specific antibody or heme agglutination test. Hepatitis A, usually transmitted by fecal-oral route, but if the patient is infected with hepatitis A virus, that will be there in the blood of the donor, then it can be transmitted by blood transfusion also. So hepatitis A virus, though usually transmitted by fecal-oral route, but when the donor is already infected with hepatitis A virus and hepatitis A virus RNA is there in the blood, the donor can infect the recipient. One serotype and multiple genotype available. Hepatitis B. Hepatitis B is the commonest viral infection that can spread by blood transfusion. The infectivity of hepatitis B is more than 100 times of HIV. Infectivity through blood transfusion, 100 times of HIV, and it is 10 times of HCV. So 100 times of HIV and 10 times of HCV. Hepatitis B has the highest prevalence of spread through blood transfusion. Now you all know this is a DNA virus, incomplete double-stranded DNA. What we detect? What we commonly detect? In hepatitis B, what is the diagnostic test? You should tell. What are the diagnostic tests used in hepatitis B? What are the tests used? Common as the earliest marker is hepatitis B surface antigen. Next is IgM anti-core antigens. So these are the two markers for acute infection. Hepatitis B surface antigen. What is the incubation period? Incubation period for hepatitis B is 30 to 180 days, average of 59 to 60 days. So hepatitis B has a long incubation period. So hepatitis B transmission through blood transfusion, if a blood contains hepatitis B, there is a 95% chance of transmission to the recipient. If the blood is infected and in window period where no antibody can be detected, so there is a 95% chance. Hepatitis C virus is an RNA virus of Flaviviridae family. HCV are categorized into 6 genotypes. So HCV can also occur through blood transfusion. Now hepatitis B, as I was mentioning, the first marker is hepatitis B surface antigen. So this is the hepatitis B surface antigen. Anti-HBC occurs later. This anti-HBC occurs later after hepatitis B surface antigen. Now HBV DNA. What is the most important role of our blood bank? What is the equipment available in most of the blood bank in India? Do you have any molecular test in any blood bank in India? We don't have any molecular test facility in the blood bank. So HBV DNA cannot be detected. But in UK or USA, they are doing the molecular test, that is NAT. In nucleic acid amplification test, this can be either PCR or this can be TMA, transcription mediated infection. So these molecular tests are not available in India in blood bank, this facility. So there is still chance of transfusion transmissible infection. HCV. HCV, there are non-structural protein NS3 to NS5. In first generation ELISA, we could detect only NS4. Then second generation ELISA came where we could detect NS3 and NS4. Then window period reduces from 26 weeks to 10 weeks. Then third generation ELISA detect NS5 antigen also, an antibody to NS5. That reduces the window period by 1 week. Now the recent fourth generation ELISA of HCV, it increases the sensitivity and specificity. Now still the average window period is 26 days. So a patient who is infected and without any symptoms can donate the blood, and if the blood is tested, it will be HCV negative. So incubation period is still, the window period is still 26 days. So this is a chance where there is a transmission of HCV can occur. Nucleic acid amplification test, This reduces the window period to, if the molecular tests are available in blood bank, it will decrease the window period to 4 to 6 days only. So to decrease the window period, nucleic acid amplification test need to be started. There is a one term, occult hepatitis C infection. What do we mean by occult hepatitis C infection? It was Castillo who has defined this term. Presence of HCV RNA in the hepatocytes and mononuclear cells in peripheral blood not in plasma or not in blood, plasma or serum, that is called occult hepatitis C. They can be divided into two types. One is seronegative, where both anti-HCV antibody and HCV RNA are negative in the serum, but seropositive means though anti-HCV antibodies are present in the serum, HCV RNA is absent. So these are the two occult hepatitis C infection. HIV. We all know two types of HIV, 1 and HIV 2 is available, most prevalent in the worldwide. Though HIV commonly transmitted by sexual activity or percutaneous exposure, blood transfusion and perinatal period, vertical transmission. What is the commonest subtype? HIV 1 subtype C is the most common subtype of HIV prevalent in India. As per NACO 2017 report, the prevalence of HIV in adult population with blood donor was 0.22%. Now can you tell what is the rate of new infection of HIV in India? And what are the number of people living with HIV? People living with HIV, there are two types. One is people living with HIV and new infection. Because that presently there is 2.3 million. 2.3 million people are living with HIV, and in 2021 data there is 67.9 thousand new infection in 2021. So still HIV is there, spread we cannot stop. So 2.3 million people still living with HIV and 67.9 thousand new infection occurred in 2021. Now what are the tests for blood transfusion? NACO strategy, which strategy is applied for blood bank? Strategy 1, 2 or 3, which strategy is applied in blood bank or any transplant? For any blood bank or any transplant, strategy 1 is applied. So NACO strategy 1. NACO strategy 1 is applied in blood bank. What is strategy 1? A single test which is sensitive to be done. If it is positive, discard the blood. And whether you will inform the donor. You have collected blood in a camp and you have tested for HIV according to the NACO strategy 1 and blood test has come positive. Will you inform the donor or not? As the patient was asymptomatic, that's why blood was collected. So according to the NACO, at least 3 tests to be done to call it positive. So we will just discard the blood and will not directly inform the blood donor. Because without consent the test was done, it was blood donated. Number 1, the consent was not there and the 3 test strategy is not here. So even the blood comes positive, we may not ask the donor to come for further test. We can inform for a unofficial information, but officially we cannot tag it as an HIV positive as a single test was done. Now, what are the tests available in HIV? What are the tests done? So, serological tests are usually of 3 types. One is lateral chromatographic, the most simple one. There may be dot blot or tri-dot assay or flow-through method. And third is comb test. Comb test is similar to ELISA. So, these are the 3 serological tests available. One is lateral chromatographic test or ICT, flow-through or dot blot, and comb test. So, these are the 3 serological tests that is done in HIV. And ELISA is the gold standard for transfusion transmitted infection in India. So, highest equipment that is available in blood bank in India is ELISA, not PCR. So, ELISA is the most of the blood bank are, have you heard the name CLIA? CLIA. What is its difference with ELISA? CLIA, chemiluminescence immunoassay. It is more automated than ELISA and has a higher sensitivity than ELISA. So, CLIA is being incorporated in many blood banks. Already SSKM has procured the CLIA. So, most of the medical colleges will have CLIA later on, chemiluminescence immunoassay. Principle is similar to ELISA, except the chromogenic substance is represented by a chemiluminescent compound. NAT. I will not go in details, but just tell what is the difference between PCR and TMA. Transcription mediated amplification. What is the main difference between TMA and PCR? Mediated amplification, just remember, thermocycler is needed, that is different temperature. In TMA, there is single temperature and single tube. So, basically RNA polymerase and reverse transcriptase are 2 enzymes involved in the process of TMA, and the reaction takes place in the same temperature. No temperature change is required. So, thermocycler is not required in TMA, transcription mediated infection. Other viruses, HTLV 1 and 2, West Nile virus, cytomegalovirus. Cytomegalovirus is an important herpes group of virus that can be transmitted by transfusion, CMV. Which patients are with highest risk of CMV transmission? Allogenic marrow transplant patient, fetuses receiving an intrauterine transfusion, a solid organ transplant patient, a person with HIV infection. Low risk autologous marrow transplant and low birth weight neonates. So, CMV is an important, most of the transfusion infection like hepatitis and HIV are transmitted through plasma. But CMV and Epstein-Barr virus, they are transmitted through blood cells, that is through lymphocytes or WBC. So, they are cell-mediated transmission. They are not plasma or serum-mediated transmission. These all herpes group of virus, they are transmitted by cell transmission. What are the tests for CMV? Particle or latex agglutination, enzyme immunoassay, complement fixation, and cytomegalovirus P65 antigen or nucleic acid amplification test. Other virus, Zika virus, severe acute respiratory syndrome, parvovirus B90. What are the special about parvovirus? পার্বোভাইরাসে আর কেন আমরা মনে রাখি? It is the smallest virus and it can cause pure red cell aplasia, or it can cause a fifth disease or slapped cheek syndrome. So parvovirus B19 you should remember as the smallest virus and single stranded DNA causing those infections. Malaria, these are parasitic organisms. What is the infective agent form of malaria? You tell. Malaria, you have already several classes of malaria. What is the infective form of malaria? When it is through mosquito bite, what is the infective form where it is transmitted by blood transfusion? What is the infective agent for malaria? Mosquito bite থেকে কি দেওয়া হয়? What are the infective form? Mosquito থেকে which form is injected in the human on mosquito bite? Anybody? What is the infective form of malaria during mosquito bite? Sporozoid. Good. Sporozoid is the infective form when it is due to mosquito bite. Now, what is the infective form when it is transmitted by blood transfusion? What is the infective form? Is it the sporozoid? You need to have trophozoid. Trophozoid is the infective form or the ring form when it is due to blood transfusion. So infective form is trophozoid. This can be asked in the oral, and blood transfusion malaria, the infective form is the trophozoid form is the infective form. Now how long if it is stored in 4 to 6 up to 6 degrees centigrade, how long the malaria parasite can survive in the stored blood, in a blood bank? Vivax can survive for 7 days, and falciparum can survive 2 to 3 weeks. So in stored blood, the vivax can survive for 7 days and falciparum can survive for 2 to 3 weeks. Trypanosoma cruzi babesiosis. Babesiosis e amra ki pai peripheral smear e? What is the form? যেমন ring form in malaria. What is the diagnostic form of babesia in peripheral blood? Babesia in the diagnostic form of babesia. Babesia is Maltese cross. It is the diagnostic form in case of babesia. Prion. What are the prions? Prions are abnormal proteins that can cause central nervous system disease, a neurodegenerative disease. They exhibit a lengthy asymptomatic dormant period. Typical sterilization method, it can resist the typical sterilization method. Now the blood transfusion mediated prion disease. What is the blood transfusion mediated prion disease? That is variant Creutzfeldt-Jakob disease. This is variant Creutzfeldt-Jakob disease, first isolated in UK in 1998, and this is variant Creutzfeldt-Jakob disease. Now you tell me, how will you sterilize a prion infected? Prion infected material, how will you sterilize? Sterilization of prion? Any idea how will you sterilize the prion infected material after an OT in prion disease. Idea about sterilization of prion. The prion sterilization is autoclave 134 degrees centigrade for 18 minutes. It is not the same thing. That is not the normal autoclave can sterilize prion. So higher temperature, pressure and for more duration. 1 mole NaOH can kill prion, but that will damage the equipment. So we cannot use 1 mole NaOH, or 2% hypochlorite for 1 hour can kill the prion. So this variant Creutzfeldt-Jakob disease, it can come as short note also other than these. Bacterial pathogens, 1 in 5,000 for platelet, 1 in 30,000 for RBC. Immunocompromised patients are most vulnerable. WHO estimates nearly 7.1 million adults. Transmission of syphilis is rare. Possible contamination, probable contamination and definite contamination. Where it is definite due to the blood, that means blood culture of the recipient and donor both blood culture positive. Now what are the features, clinical feature? How will you diagnose it is a transfusion-transmissible blood bacterial infection? Temperature will be raised 102 degree. A temperature increase of more than 2 degrees centigrade or 3.6 degree Fahrenheit. There may be rigor, heart rate more than 120, rise or fall in systolic blood pressure more than 30. Now what are the treatment, course of action? You immediately stop the transfusion when this rigor and temperature rise occurs. Then aggressively hydrate and resuscitate the patient. Make sure the signs of what to be tested. The blood again to be tested for grouping and cross matching. Whether this rigor and due to the transmitted infection or due to mismatched transfusion. So you have to recheck in the blood bank for mismatched transfusion. So that already I have mentioned, the likely to be disinfected skin during collection and also transfusion to prevent local flora. These already I have gone through. HTLV, West Nile virus, cytomegalovirus seroprevalence is 40 to 100% worldwide. The chance of CMV infection is 0.38%. Zika virus, no confirmed cases of Zika virus in India through blood transfusion. Parvo B19 already I have covered. Now how will you infection the bacterial infection? How will you investigate in the lab? Either plate culture, automated culture or BACT alert or scan system. Visual inspection, while starting the transfusion, what you should do, you visibly inspect the blood for any change in the discoloration or hemolysis. Gram stain can be done later, microvolume fluorimetry and flow cytometry. Endotoxin assay and other molecular techniques. Emerging infections that can be classified into the red, orange, yellow and white. Red means low to strong scientific evidence. Variant Creutzfeldt-Jakob disease falls in the red, dengue in the red and babesia in the red. Chikungunya, leishmania, plasmodium in the orange. And yellow, hepatitis A, HHV8, HIV variant. Now these are the two parts usually after collection of blood. What can be done to prevent infection? One is pathogen inactivation and another is pathogen reduction. Pathogen inactivation refers to the complete prevention of infectivity, while pathogen reduction refers to decreasing the amount. How we can, what are the two mechanisms of pathogen inactivation? One is chemical, another is photo inactivation. Other is solvent and detergent treatment. These are the solvent or detergent agent used: methylene blues, sodaline, riboflavin plus light, pain 110. Now, the whole transfusion transmitted infection, you at least remember the key points. What are the key points in TTI? TTI are supply of safe blood, primary responsibility of the blood centers or blood bank. আমাদের ইন্ডিয়াতে which tests are done? We duly test for HIV 1, 2, hepatitis B, hepatitis C, malaria and syphilis. These tests are done. These are mandatory. DCA guidelines, these tests are mandatory, but as per NACO 2017 report, prevalence of HIV, HBV and HCV, India was around, so still there is 0.12% chance of transmission of HIV, 0.89% chance of hepatitis B and 0.3 chance of hepatitis C virus. HIV virus is well preserved in refrigerated as well as frozen blood. So HIV is preserved. First marker is hepatitis B virus DNA. So until and unless we implement the nucleic acid amplification test in the blood bank, we cannot prevent the window period thoroughly. HCV can be transmitted incompletely inactivated plasma fraction. Other hepatitis virus transmitted through transfusion. Cytomegalovirus transmission can be prevented by leukoreduction. As I have mentioned, all hepatitis virus which are transmitted by transfusion are cell mediated. So if we decrease the blood transfusion is usually done due to blood loss or some platelet decrease. If it is due to blood loss, RBC is required, WBC is not required. So leukoreduction can be a method by which we can decrease the chance of transmission. So leukoreduction for cytomegalovirus. Bacterial contamination is a rising concern. Stringent donor selection, diversion pouch in a blood bag, optimum storage, leukoreduction and bacterial screening test. The advantage of serological testing from first generation to fourth generation has decreased the window period. Now CLIA is preferred over ELISA. TTI screening by NAT, RT-PCR or TMA technique is increased day by day in India. In many blood bank, in private blood bank, they are incorporating the molecular test like PCR or TMA.